This is our presentation on acute post-streptococcal glomerulonephritis. Pathophysiology, it's the inflammation of the glomeruli. It can be acute or chronic. Acute form discussed later. There are two types of antibody-induced injury. There's anti-GBM, which affects the basement membranes, or the antibodies react with circulating non-glomerular antigens and are randomly deposited along the glomerular basement membrane. All forms are characterized by an accumulation of antigen, antibody, and complement in the glomeruli, which can result in tissue injury. Immune complexes activate complement, causes a release of leukocytes, histamine, and other inflammatory mediators. The three types of glomerulonephritis is acute, rapidly progressive, and chronic. We're going to be talking about the acute post-streptococcal glomerulonephritis, which is a form of glomerulonephritis that affects mostly children and young adults. It develops 5 to 21 days after an infection of the throat, pharynx, or skin. It's by the nephrotoxin strain of group A streptococci. Person produces antibodies to the streptococcal antigen, which leads to the tissue injury. Some risk factors: a recent infection with streptococcal, autoimmune diseases such as Goodpasture syndrome, lupus, or heavy use of NSAIDs. Some clinical manifestations: there's a generalized body edema, initially in low pressure tissues such as around eyes, but later progresses to total body as ascites or peripheral edema in legs. Another clinical manifestation is hypertension, which results from an increase in fluid. Other signs and symptoms: we have oliguria, hematuria with smoky or rusty appearance, proteinuria may occur, and they may have flank pain and abdominal pain. Some complications that can arise: 95% will recover completely or improve rapidly with conservative management. 5 to 10% will develop chronic glomerulonephritis, and irreversible renal failure occurs in 1% of patients. So our case study. Jacob Smith is a 10-year-old Caucasian male who has presented to the doctor's office with his mother. Jacob was recently seen at the doctor's office 3 weeks ago for a sore throat. A throat culture was performed by the nurse and was positive for strep. Jacob was sent home with antibiotics and told to follow up with any issues. Jacob's mother told the nurse that she is worried because her son's urine is funny looking, and she has noticed that her son's face looks puffy. Jacob has no complaints of pain. So on the initial physical assessment, the vital signs of significance was the heart rate was 70, the respiratory rate was 12, and the blood pressure was 144/99, which is high. There was periorbital edema noted bilaterally. The patient was alert and oriented, and crackles were noted bilaterally in the lower lobes of the lungs. The urine assessment: there was a dark cloudy with a rusty appearance but no foul odor. There was 3+ pitting edema noted bilaterally on lower extremities. On the psychosocial assessment, Jacob is in 4th grade. He's nervous about doctors and nurses, does not want to get a shot. Mother is a stay-at-home mom with 2 other children. Diagnostics. Diagnosis is based on a complete history and physical examination and laboratory studies. An ASO titers performed and assesses for immune response to Streptococcus. C3 and CH50 are complement components. If decreased, indicates immune-mediated response. There's also a dipstick urinalysis performed, which will reveal erythrocytes or protein in the urine, and then they will monitor the BUN and serum creatinine. So Jacob's results: the BUN was 35, which is elevated. Serum creatinine was 2.1, which was also elevated. The dipstick urinalysis was positive for erythrocytes and positive for proteins, and Jacob was positive with the ASO titer. So the nursing management, we're going to focus on symptomatic relief. Rest is recommended until the signs of glomerular inflammation and hypertension subside. Edema is treated with restricting fluid and sodium intake along with diuretics. Hypertension may be treated with drug therapy. The goal is prevention. Educate patients on properly seeking health care when sore throats or lesions appear. Take prescription antibiotics and take the full amount. Maintain good personal hygiene. Help prevent the spread of cutaneous streptococcal infections.
Okay, some medications that could be used in treating this complication. We have captopril, due because of the edema, which is an ACE inhibitor. It's used for treating the hypertension, and it's taken an hour before meals. Some side effects of captopril, they include cough, hypotension, tachycardia, and palpitations. Patient's response. Patient will have lower blood pressure without causing any significant adverse effects. The second medication that is used in treating the elevated blood pressure is amlodipine, also called Nurvsec. Its action is it blocks post-excitation release of calcium ions into cardiac and vascular smooth muscles, thereby inhibiting the activation of ATPase on myofibril contraction. This results in dilation of coronary and peripheral arteries, leading to decreased blood pressure. Some side effects of amlodipine, as I said, is a calcium channel blocker. They include peripheral edema, bradycardia, hypotension, dizziness, fatigue, and gingival hyperplasia. Another blood pressure medication that could be used is hydralazine. Its action is it decreases systemic resistance through direct vasodilation of arterioles. Side effects include sodium retention, tachycardia, orthostatic hypotension, dizziness, and drowsiness. Patients who are suffering from post-streptococcal glomerulonephritis, and having the effects of hypertension, taking antihypertensive medications, some teachings for them. We take medications as prescribed, proper technique for blood pressure monitoring, importance of maintaining good dental hygiene, caution to change positions slowly to minimize orthostatic hypotension. Some medications that will be used to manage the generalized edema. We have Lasix, which is a loop diuretic. It's used for edema and can also be used for the treatment of hypotension. Its mechanism of action is it works on the ascending loop of Henle, which causes sodium retention and thereby it inhibits sodium retention and thereby inhibits water retention. Side effects include hypokalemia, diarrhea, cramping, dehydration, and dizziness. Another blood medication that could be used to treat edema is dioxide. It's a diuretic, but this medication is used only in emergency situations where there's a rapid need to reduce blood pressure. It's given only IV, and it produces direct smooth muscle relaxation of peripheral arterioles, which decreases blood pressure. Side effects include hypotension, tachycardia, hyperglycemia, dizziness, headache, vomiting, and constipation. Patient teaching with diuretics. We advise patient to take medication as prescribed, advise patient to change position slowly to minimize orthostatic hypotension, and the importance of routine follow-up for labs so as to monitor CMP and BMP during therapy. We need antibiotics if the throat swab showed there was still lingering effects of streptococcal bacteria, and one of the antibiotics used is cephalexin, that's Keflex. It's a cephalosporin, and it acts as a bacteriostatic, which inhibits proliferation of the bacteria. Some side effects include super infections, pruritus, GI upset. And another antibiotic that could be used is erythromycin. Erythromycin inhibits bacterial growth, possibly by blocking the dissociation of the transfer RNA from ribosomes, causing RNA-dependent protein synthesis to arrest. Side effects include seizures, ototoxicity, Torsades de Pointes, ventricular arrhythmias, colitis, nausea, and vomiting. Patient teaching on antibiotics: we teach patients to take medications as prescribed around the clock and to finish the dose prescribed completely. Notify healthcare provider if increased diarrhea occurs, and teach patient on oral contraceptives to use an additional non-hormonal method. Generalized patient teaching on a patient who has acute post-streptococcal glomerulonephritis include: we teach patients to have frequent rest periods until the signs of glomerular inflammation and hypertension have subsided. Teach patients to elevate lower extremities to minimize effects of peripheral edema. Encourage patients to limit amount of salt and fluid intake to minimize edema. Dietary proteins intake may be restricted if there is elevated BUN to decrease production of nitrogenous waste. Teach patients to maintain a low protein, low sodium, and fluid restricted diet. Daily fluids intake are normally restricted to 1,500 mLs. If antibiotics are prescribed, we teach the patient to take the full dose and not to stop when symptoms are relieved. This is to ensure the bacteria is completely eradicated. Teach signs and symptoms of streptococcal infections, such as sore throat, fever, skin lesions, and the importance of seeking treatment early when symptoms occur. Teach good personal hygiene, such as hand washing, to prevent spread of cutaneous streptococcal infections. Okay, we go now to our nursing diagnosis. The first nursing diagnosis is excess fluid related to decreased oncotic pressure and water retention. That's plasma protein shift, as evidenced by +3 pitting edema to bilateral lower extremities. Patient will return to normal fluid volume. Expected outcome: patient will return to normal weight with no evidence of edema. Evaluation of outcomes: by end of shift, edema decreased to +1, goal partially met. Interventions: nurse will obtain daily weights at the same time every morning with the same clothes. Patient response: patient's mother agrees to assist with daily weights. Second intervention: assess for pitting edema, Q shift, noting presence of radial and pedal pulses. Patient response: patient cooperates with assessment. And third intervention: measure intake and output Q 4 hours to note discrepancies in intake. Patient's response: patient's mother understood on reasoning for monitoring input and output. Our next intervention is to encourage patients to elevate lower extremities when resting, and also to wear TED hoses during the day. This is to help compress the fluids from lower extremities up such that they can be circulated and eliminated. And patient response: patient elevated lower extremities for 2 hours while resting. And our last intervention for excess fluid volume is to teach patients to follow fluid restrictions and low sodium diet per doctor's orders. In this case, a fluid restriction of 1,500 ml is recommended. This is to ensure excess fluid is not taken in. And patient response: mother expresses understanding of fluid restrictions. Our second nursing diagnosis is risk for impaired skin integrity related to tissue edema, as evidenced by +3 pitting edema to bilateral lower extremities. Our goal: patient will be free of skin breakdown. Expected outcome: patient will show no evidence of skin breakdown over bony prominences and feet. Evaluation: patient had no reddened areas over bony prominences and feet. Impaired skin integrity interventions: assess skin for breakdown secondary to edema and bed rest every shift. Patient response: patient remain free of skin breakdown. Our second intervention is to encourage position change every 1 to 2 hours, provide skin care, and use a therapeutic mattress such as a Warfarin mattress. Patient response: patients change positions every 2 hours. Apply moisture barrier to edematous skin sites to prevent skin breakdown. Patient's mother applied moisture barrier to lower extremities. Use a therapeutic mattress such as Warfarin mattresses is encouraged. Patient response: patient had a Warfarin mattress placed in bed. And our last intervention is to teach family to perform skin checks daily. This mostly because patients with acute post-streptococcal glomerulonephritis are mostly at home based, so family has to take care of them at home, and family understands teaching. Our third nursing diagnosis is activity intolerance related to fluid and electrolyte imbalance, as evidenced by fatigue. Goal and expected outcome: patient will progress in activity tolerance without excess fatigue as disease process improves. Evaluation: unable to access during 8-hour shift. Activity intolerance interventions: assess patient's level of mobility and vital signs before activities. This is to obtain a baseline for comparison at the end of activities. And patient response: patient heart rate remained within normal limits with no signs changes of blood pressure. Second intervention: provide for quiet play according to developmental stage of the child. This helps to conserve energy. And patient's response: patient watched TV and played computer games. Third intervention: maintain bed rest during acute stages. This is to enable conservation of energy. Patient's response: patient remained in bed during acute stage. And the fourth intervention is to encourage adequate rest periods, especially before meals, other activities of daily living, exercise sessions, and ambulation. These rest periods, it helps conserve energy, so it builds up energy such that it's being used during activities to diminish tiring. And patient alternated rest with activities. Fourth nursing diagnosis: effective management of therapeutic regimen by parents related to child's medication schedule and treatment regimen after discharge, as evidenced by written demonstration. Expected outcome: the parent will state knowledge of child's treatment regimen after discharge. Evaluation: parent accurate knowledge of medication regimen by written demonstration. Nursing interventions. Assess parents' understanding of needs for compliance with medication schedule. Um, Parent understands reasons. Second intervention, describe best schedule for giving medications to match child and family's routines. Patient response. Parents have filled out planner with date and times to give medications. Third intervention, inform parents about potential side effects of prescribed medications and signs and symptoms of complications. This is to let parents know what to watch for if any adverse reactions occur to medications. Patients respond. Parents understood teachings of side effects. Have parents give written demonstration and explanation of teachings about medications regimen. Patients respond. Parents accurately explain medications regimen. This is to assess their understanding of teaching. Our fitness in diagnosis is impaired social interaction related to hospitalization as evidenced by dependent behavior, that is wanting mother to feed him. General outcome, family will become involved in achieving positive change in social behavior. Evaluation, goal met, parents brought 2 classmates to visit with patient. Nursing interventions, assess clients' use of coping skills and defense mechanisms. Patient's response. We noted patients uses regression as a defense mechanism. Second intervention, encourage clients to express feelings and perceptions of problems. Patients respond. Patient states he misses playing with his friends. Our next intervention is to involve in role playing new ways to deal with identified behaviors or situations. This provides an outlet for the child to express themselves. And patient response, clients started to make pictures to give to nurses. Fourth intervention, encourage parents to visit and encourage visits from classmates. This will give the child an opportunity to play with classmates even though hospitalized. Patient's response, patient had 2 classmates visitors. Okay, and the last slide is on our references. So now Darby is going to go over our concept map.
Okay. Our concept map, we pretty much went over it in the slides. We just wanted to come up with why excess fluid related to decreased oncotic pressure was our number 1 nursing diagnosis. And we figured that it leads to impaired skin integrity due to the edematous skin, which can cause the skin to crack and break, as well as lead to immobility, which therefore can lead to bed sores. And it also can lead to activity intolerance, because when you have those fluid shifts going, it can cause fatigue, generalized malaise, and all that stuff. As for it relating to impaired social interaction, if you can look at it in a general way, when you have increased fluid retention, it leads to all those other things, which makes you homebound or hospital-bound and makes you tired, so you can't go on with your normal everyday to-day life. And our second ranking nursing diagnosis was impaired skin integrity, followed by activity intolerance, social isolation, and then the engagement one with the parents. Okay, thank you.